beauties, my name is Daisy, and today on TMI Tuesdays I am going to be talking about ovarian cysts. So on every Tuesday I cover a topic that you want to know but are too afraid to ask, so don't forget to hit that subscribe button. So I'm going to talk about first what ovaries are, how cysts forms, symptoms, and treatments. So the ovaries are two small organs located on either side of the uterus in a woman's body. They make hormones including estrogen which trigger menstruation. Every month, these ovaries release a tiny egg. The egg makes its way down the fallopian tube to potentially be fertilized. This cycle of egg release is called ovulation. So what causes ovarian cysts? Well, cysts are fluid-filled sacs that can form in the ovaries. They are very common. They are particularly common during the childbearing years. There are several different types of ovarian cysts. The most common is a functional cyst. It forms during ovulation. Other types of cysts include polycystic ovaries. In polycystic ovary syndrome, or PCOS, the follicles in which the eggs normally mature fail to form and cysts form. Endometriosis. In women with endometriosis, tissue from the lining of the uterus grows in other areas of the body. This includes the ovaries. It can be very painful and can affect fertility. Cystadenomas, whatever. These cysts form out of the cells on the surface of the ovary. They are fluid-filled. Dermoid cysts. These types of cysts contain tissue similar to that in other parts of the body. That includes skin, hair, and teeth. So then what causes these ovarian tumors? Tumors can form in the ovaries just like they can in other parts of the body. If the tumors are non-cancerous, they are said to be benign, but if they are cancerous, they are said to be malignant. So doctors aren't exactly sure what causes ovarian cancer, though they have identified there are several risk factors, including age, specifically women who have gone through menopause. 2, smoking. 3, obesity. 4 is not having children or not breastfeeding. However, using birth control pills seem to lower the risk. 5, taking fertility drugs. 6, hormone replacement therapy. And the last, family or personal history of ovarian, breast, or colorectal cancer. So what are the symptoms and what should you look out for? Often, ovarian cysts don't cause any symptoms. You may not realize you have one until you visit your healthcare provider for a routine pelvic exam. Ovarian cysts can, however, cause problems if they twist, bleed, or rupture. If you have any of the symptoms below, it's important to have them checked out. That's because they can also be symptoms of ovarian tumors. Ovarian cancer often spreads before it is detected, so make sure you get those pelvic exams. Symptoms of ovarian cysts and tumors include pain and bloating in the abdomen, difficulty urinating or frequent need to urinate, dull ache in the lower back, pain during sexual intercourse, painful menstruation and abnormal bleeding, weight gain, nausea or vomiting, loss of appetite, feeling full quickly, etc. So how do doctors diagnose this? The obstetrician or gynecologist or your regular doctor may feel a lump while doing a routine pelvic exam. Most ovarian growths are benign, but a small number can be cancerous, so that is why it is important to have these growths checked. Postmenopausal women should get examined more often because they have a higher risk of ovarian cancer. So the way they look for these include ultrasound. They also can look at hormone levels. So the doctor may take a blood test to check several levels of hormone. There's something called laparoscopy, and this is a surgical procedure used to treat ovarian cysts. It uses a thin, light-tipped device inserted in your abdomen. During this surgery, the surgeon can find cysts or tumors and may remove a small piece of tissue to test for cancer. So then let's say, unfortunately, you do have these problems. How are they treated? So a lot of time the cysts will go away on their own, especially if you don't have any bothersome symptoms and you haven't gone through menopause. Your doctor just may advocate watchful waiting. So the doctor won't treat you, but they'll just kind of keep an eye on you to make sure that you're doing fine. Also, birth control pills may relieve the pain from ovarian cysts. So birth control prevents ovulation, which reduces the odds that new cysts will form. So thank you all so much for watching on this episode of TMI Tuesday. I think although we do a lot of beauty videos and it's important to know the right foundation that matches your skin. I also think it's really important to just know these health issues that we should talk about, even if it's not so glamorous or sexy. Let me know what you want me to talk about for next week's TMI, and until next time, I'll talk to you guys later. Bye!